What is the best treatment for my upper and lower lids? Thermage? Surgery? Thank you.
Thank you for your question. You asked a very simple question where what is the best option for you for your upper and lower eyelids, whether it's thermage or surgery? Well, the question also has to be defined by what is your desired outcome. And when I look at your eyes, I see a significant amount of hooding in the upper eyelids. Now, for many years, people have been trying to figure out ways to avoid surgery through all kinds of heating devices. And I won't necessarily identify Thermage as the only one. There is a tremendous number of heating devices where they try to improve upper eyelid hooding by trying to heat up the skin in the forehead and raise the eyebrows. So, as a cosmetic oculofacial plastic surgeon, I get to see a lot of patients who tried all of these heating devices, and uniformly they have been disappointed. Now, why is that? These heating devices make it to all kinds of television shows, and people are always excited by some type of new non-surgical device that is supposed to make surgery obsolete. And yet, I and hundreds and hundreds of cosmetic surgeons perform surgery every day, because essentially there's a limit to what these devices can do. I happen to have a radiofrequency device, and certainly I see the benefit, but in a limited way for very specific things. So when I use my radiofrequency device, it's to treat some very fine lines. But the application of high levels of heat to try to cause skin to contract often has a very paradoxical effect. It has been my observation that these high levels of heat, which many patients find intolerable, and many actually abandon their treatment because they're supposed to come back for a series of treatments, which is considerably more than any surgical procedure. But they go for the first or second treatment, and then it's very painful, and temporarily they kind of like the look because they're swollen. Swelling is not long-term. When the swelling goes away, the skin goes back to normal, and in many cases I have observed that the skin actually gets thinner. We have actually been very busy helping people who have gotten thermal energy device treatment, and we're trying to help them rehabilitate their skin by using technologies such as platelet-rich plasma to try to rebuild some of the collagen and some of the blood supply that's been lost. The holy grail in all of this has been the critical amount of heat to tighten the skin in order to get a long-term benefit. And there's continuous frustration for the patients who buy the hype, and it's sold so aggressively that they end up being seduced by the technology and the presentation. But in the end, I have yet to be impressed by the results of any of these devices when compared to more definitive procedures. For your upper eyelids, I would most likely recommend an upper eyelid blepharoplasty. In our practice, we do these procedures under local anesthesia with light IV sedation so that it is essentially extremely safe, and even if you are, quote, against surgery, it is not likely you'll be able to find an alternative that would do it any better than an actual definitive surgical procedure. Understanding that what we did in our practice by having our own facility within our practice, we made the whole surgery experience a lot more easy to take. It's not like going to a hospital or going under general anesthesia, which can be very intimidating situations, and of course there's risks to general anesthesia, and that we don't have to go over that at this time. As far as your lower eyelids are concerned, from my perspective, the lower eyelids are a little bit low, but again, this might be a more of a genetic issue. And so the advice that I would give you would be based more on a physical exam. So if there's puffiness or fatty pockets under the eyes, we would address that surgically. If it's about fine lines and wrinkles, well, there are options such as laser devices like fractional CO2 laser. We combine fractional CO2 laser with platelet-rich plasma routinely to get this nice synergy because we want to distinguish quality of the skin versus quantity of skin. We see patients from all over the world who have had skin removed in an attempt to tighten wrinkles, and invariably their lower eyelids get pulled down and they develop lower eyelid retraction. We are focusing so much more on the qualitative improvement of the skin through the use of platelet-rich plasma, which helps stimulate the blood supply and the collagen, and it's a remarkable benefit to improving skin quality. It may require more than one treatment, but that is where we are focused in our practice in terms of how to improve skin quality. It's not about heating alone. Heating is part of the story, but the regeneration is what we have been very, very actively pursuing to try to build the quality of the skin. So I would suggest you meet with a surgeon who can give you a more definitive evaluation, and you can have the communication that you need in order to understand what your desired outcome is. Once you've defined that, then I think it'll be clear that most likely for what you want, the heating devices are not likely to deliver. So I wish you the best of luck. I hope that was helpful, and thank you for your question.